I'm going to actually invest, I have 12 minutes, but I'm so generous, I'm going to invest 60 seconds, 1 minute of that into doing some activity with you all. So please humor me. Would you mind just standing up wherever you are? Please just stand up. These lights are very bright on my eyes. I can barely see you. Thank you. So if your birthday, the last number on your birth date is an odd number, hold your hands like this. If the last digit of your birthday is an even number, hold your hand like this. Stay there. I really need you two to do this because you will understand very soon why. Thank you. Stay like that. And now, let's see if technology will work. Great. It does. Thank you. All right. Thank you so much. Now I have proof that I got a standing ovation at the Agents of Change conference. So I appreciate that. You will, if you tag me, you will see this picture on social media. Thank you. My name is Sheoran. I am, the introduction said I'm Chief of Staff, but depending on where I am, I'm also Chief Health Officer and Chief Growth Officer. But since today I'm not here to ask you for money, so I'm going to put that hat away. I'm also not here to talk about HR, so I'm going to put the Chief of Staff hat away, but I am here to talk about health. I'm the Chief Health Officer of a social impact startup called SET based in the Silicon Valley, but please don't hold that against me. Meta, are you still in the house? I'm sorry if I offended you, but all my colleagues know this, and I say this often, which is every day for me is a career-ending opportunity. So I say what comes in my head. So my career started as a medical doctor, moved into global health, public health, and I was one of the early sort of transference from public health into technology and integrating that into the work that we do, which is what brings me here today. But enough about me. Let's talk about SET. I love to start talking about SET by sharing with you this story. The story is of Lucia. In 2014, Lucia had moved to California. She was a new immigrant, didn't speak English very well, but she moved here with her children, got a minimum paying job, tried to get her kids into good schools, but was really looking to improve her English skills as one of the first things that were needed for her to get a better job, to get a better life for her children. But the challenge was in 2014, every place that she went to learn English, to gain her English literacy skills, she was required to have internet access or a computer if it was an online program. If it was an in-person program, she was required to travel to a place or a venue, to a class, spend hours there, away from her children, away from other things that she could be doing. So the opportunity costs were significant. But one thing that she did have with her was a feature phone. And you will all probably agree that no matter what phone you have, there are two things that every phone almost always does these days, mobile phones. They all have the ability to send and receive text, and they all have the ability to send and get voice calls. And that was the genesis of SET as an organization that focused on building very simple front-end technologies to reach communities that are most vulnerable, marginalized, and often left behind by tech developments and other developments. So we created SET. We took literacy lessons that were highly effective otherwise and curriculum, and we turned them into micro lessons that we could deliver via text to Lucia. And then we also took those micro lessons and had voice artists record them in English and Spanish so that she could actually hear those lessons, listen to those lessons, understand pronunciation, etc., right? And that was the genesis. And the question was, well, was it effective? The answer is yes. We did a randomized control trial, the gold standard for efficacy testing, as most of you will agree probably, and demonstrated really, really good outcomes, right? I won't bore you with the numbers, but if you are a data scientist and would love to get more information, please come to our website. The whole study is there, links to the journal articles, etc. But it demonstrated clear efficacy, and we're like, oh, we have something here. So we started building on that. One of the mantras that we adopt at the place that I work in is, what works even better if? WWEBI, right? I joined this organization and they were using this word and I was like, I have no idea what you mean by this. What is WWEBI? But that has been the mantra. What works and even better if? So we've continued to build on what SET had started as and then added new features, functionalities to make it even better, even more user-friendly. So at the front end, the platform, the interface is very simple, very easy, very user-friendly, but the back end is very sophisticated, and I'll share with you the details of what that actually means. Here are some of the unique features of the SET platform. Radical accessibility. We're centered in equity, right? So we try to create programs so that they can be delivered across multiple devices, all the way from having a basic featured phone to having a smartphone. You can access our lessons and trainings via text, via voice, download the app, use that, go to the web app, use that, et cetera, et cetera. Radical accessibility. Customizable. We take content that already exists, and there's tons of really good content out there, and we turn that into the content that can be then delivered on the SET platform. We also create our own content. Micro-learning, attention spans, really, really high opportunity costs. One way of reducing that is delivering lessons that can be taken in 3 to 5 minutes, sitting in a bus on your way from work, going back home, via text, via phone call, via your smartphone app, or via web app. Radical accessibility, I want to go back to that because one key element that often gets overlooked is access to the internet, right? So because of the way we deliver these services, you actually don't need access to the internet. You can access all our solutions, all our trainings, without having the need to be connected to the internet. Engaging lessons. You know, all of us are in the field, we do behavior change, and so our lessons are really engaging, they're fun, they're exciting, and really engage our audience. Multilingual, if you are in America, which is the melting pot, creating and delivering a campaign or a training in just one language when you're trying to serve populations that include immigrants doesn't work. So our platform delivers these trainings across multiple languages, English, Spanish, obviously, Portuguese, Swahili. We have almost, at the state, probably 12 to 14 languages that we have integrated into the platform. So these are some of the unique elements of what SET does. As we had started, as you remember the story of Lucia, right? So it was around English literacy. But there was very quickly the realization that the communities that we were reaching through our literacy programs were almost always also the communities that were disproportionately impacted by the negative health outcomes, just because of who they were. So we very quickly integrated health into our literacy program. So now that's what we do. We do literacy. We do digital literacy, numeracy, financial literacy, business English, but we do a lot of health work, and that's where my role comes into play at SET. So how can you engage with SET? Very simple. If you are joining the program, you get a PIN code. You can text it on your phone to join the program, join the training, or you can call our number and give them the PIN code, and that's one way to join the training. You can download the app, enter the PIN code, join the training, et cetera, et cetera. You can go from text to voice to smartphone because our backend tracks your training, what you're doing across all those platforms. So I might be able to access the training program or my smartphone app when I'm at home, but when I'm on the bus, I can actually integrate or access my training programs through text or voice. So you start taking the programs, right? Then what happens? Let's go back to what I said, WWEBI. Who remembers what that stands for? This is a test. You will be scored. Anyone? What works even better if, right? So we knew what was working. But we said, oh, this has got to get better. So there are a lot of programs out there that use technology to reach and train people. There are online programs, offline programs. But one thing we realized what was missing was that human touch. So we integrated that human touch through our coaching program. So every trainer, every learner, every trainee that participates or takes training around health, behavior change, et cetera, on our program, on our campaign, on our platform, is connected to a certified coach who has cognitive behavior therapy expertise, motivational interviewing, appreciative inquiry. These coaches do a warm welcome with all our learners. And then work with them to identify what their goals are for the training, and then they serve as mentors. They help them navigate the platform. They help them overcome barriers to retention. They help them achieve their training goals, and we have seen significant improvements in retention and completion rates once we added the coaching component to the SET platform. And of course, no platform is complete these days without data analytics, obviously. We need it internally to keep learning, keep getting better, right? But externally, a lot of our partners are public health departments, CDC, et cetera, and they all need data in their reporting in terms of what's happening. So the back-end data analytics that we have is pretty robust. We can track, obviously, easily how many people have entered the training, how many people have completed the training, where are they on their journey for the training, where are they getting stuck, what are the completion rates, et cetera, and we can make it available 24/7 on a very comprehensive dashboard. When we are talking about data analytics, very quickly the conversation moves into, what about privacy and confidentiality? And then very quickly somebody will ask you, what about HIPAA compliance? Almost always, which is a great question. But these days, any tech platform worth its salt obviously is HIPAA compliant, has protective features around personally identifying information or personal health information. But there's one thing that we did that went way beyond it. We are now SOC 2 compliant. For those folks who keep themselves informed, SOC 2 is really a global auditing mechanism. It's best in industry, best standards, that actually comes in and does an audit of your platform, but it doesn't stop at just the platform. It looks at your whole infrastructure. It looks at your staffing. It goes down to what kind of email element or platform do you use for communication, and things like that. So it works on making sure PHI and PII are protected, but it also makes sure that the organization has disaster management plans, has protocols in place if there's a data leak, et cetera, and how to respond to it, how to fix it, et cetera, et cetera. This whole audit process actually takes 4 months. Everybody in the organization has to go through trainings, irrespective of whether or not they're dealing with data. So we've gone through that. We are SOC 2 compliant, which makes me very happy. So we've talked about going directly to the user, right? And we work with them. But we also work on the workforce or with the workforce. So we do trainings with the workforce, but we don't just do the trainings. We actually provide wraparound services because our providers, front-end caregivers, et cetera, they need more than just trainings, right? So our coaches actually work with them to constantly identify what their training goals are, training needs are, and we either deliver the training ourselves or we link them to other training opportunities. But we also then manage bronze management software, so that when an agency is putting out RFPs, we manage it for them. We also have a way of having a help desk. We provide that support. We do financial dissemination of incentives and stipends to front-end workers. So depending on what the needs of our partners is, we provide those wraparound services in addition to the actual training platform. So let's talk about some of the new things that have been happening. And you can't talk about new things without talking about AI, right? So how many of you have heard about ChatGPT? If you haven't, you've been living under a rock for sure. So let me just say that. ChatGPT, right? So such a fantastic application of AI and using OpenAI. If you are, for example, in a job search, I'm not saying that you are, but in case you are, use that. Use ChatGPT. Go in, do 2 things. 1, take the job announcement, plug it into the prompt. 2, take your CV and all your expertise and skills, plug it into the prompt, and then tell or prompt ChatGPT to say, hey, spit out a 1-page cover letter that shows how my skills are related to the job requirements or the job announcement. And within seconds, you will have your cover letter. Isn't that awesome? But I digress. Let's see how AI has been used by us. So what we did a few years ago, actually 2 years ago, we worked with Rescue Agency, and we went out into the community, and we did some really solid research. Well, to be fair, Rescue did all the research and came back to us and made recommendations on how we could actually allocate personas to our trainees so that we could identify what their motivational factors were, which would allow us to really engage with them using their motivation factors to get them to join training, create their training goals, stay within the trainings, complete their trainings, right? And we've been using AI more and more since that. The other thing that we all will probably agree when we do behavior change is that not the same thing works for the same person or everybody at the same time in the same way, right? So we are starting to create personalized pathways, so when somebody joins the training program. We go through an intake process that helps us identify what is going to be the best path of learning or behavior change for that person, and we use AI for that. And then we give them that path so that they go through that training, go through that intervention to achieve their health goals, et cetera. So I've talked about the platform, but let me now give you a couple of examples of how we have applied that. And this is more of a biomedical intervention, but it sort of illustrates how SET works. Society of Vascular Surgeons, we collaborated with them. Some of you might have heard or be familiar with peripheral arterial disease that leads to pain in the legs. Walking is a great way to build your capacity and reduce pain in the legs and reduce negative outcomes or prevent negative outcomes of peripheral arterial diseases. And that intervention is called scheduled exercise therapy. Typically in the past, a patient would have had to go to a center to be supervised while they were doing their walking activities. But that was a very costly intervention, right? So we took that intervention, we added activity trackers onto our platform, and then we piloted it for 6 weeks with a large cohort of patients with peripheral arterial diseases. And at the end of that, and these patients were linked to our behavioral change coaches as well. And at the end, we saw significant improvement in their walking scores, which is one of the key indicators of preventing complications of peripheral arterial disease. I'm almost done. So here is the last slide with my contact information. If you have a smartphone with a powerful camera, please feel free to scan the QR code. I love to build our community of practice. I would love to connect with you on LinkedIn. If you have any questions, reach out to me. If you would love to explore new ideas, new interventions, if you want to explore partnerships, I would welcome your outreach, and I look forward to connecting with you after this session is over and in the coming days. Thank you so much for listening to me. Thank you so much for bearing with me while I took you through the last 12 minutes. Thank you very much.